All right, good morning, everybody. Thank you for joining us on this Basics of My MFG for New Agents. We will begin the webinar right now. Nelson Portillo is going to be our presenter today. Nelson, take it away.
All right, thank you, Chris. Good morning and good day to everyone. Thank you all so much for joining us today. As Chris said, thank you for setting some time aside to join us for our webinar. My name is Nelson and I'm part of the producer support team here at Messer Financial Group. The purpose of today's webinar is to go over the features and enhancements that our proprietary platform software, MyMFG, has to offer. For some of you, this webinar will be a refresher, but there are some additional features that we have implemented in the last couple months, so you should find this overview quite useful. For those of you who have never used MyMFG, this webinar will serve as an introduction to the many features that MyMFG has to offer. After the tutorial, we will have some time for any questions that anyone may have. So without further ado, let's dive in. Oh, I will say, any questions that you do have, please hold to the end, just notate them. We will get some time at the end to answer those, but for the sake of just getting through MyMFG, we'll hold that for the very end. So mymfg.app is the official web address for the MyMFG site. However, we are going to navigate there today via our Messer Financial website. So we'll go to messerfinancial.com. and we'll go over to the right and see the orange MyMFG logo, and we'll click there. And this will redirect us to the MyMFG website, where you will log in by using the password you created when you receive that MyMFG access activation email. And then your username is just going to be your initials with the last four of your social. If you have any issues with your password, be sure to call our producer support team. We will be able to help you reset your password or reset your attempts to log in case you get locked out. I'm going to close this tab because I will be using a staging account today. It is important to note that here a little further down, you can see any software updates or status changes. Once you click login, you are sent to our landing page. This is the MyMFG dashboard. On the top left, we can see the profile icon. The first page of your dashboard is the MyMFG sales page. Here you have an overview of your MyMFG sales for ACA and Medicare together or separately. With either option, you do have some filter options such as filtering by the carrier or a specific time frame. If we scroll down, you have a couple visual diagrams. These are some useful features available at a quick glance. You have a bar graph that shows sales reports per month, a chart that shows sales rankings comparing this year to last year. And we also have a line graph demonstrating a year-to-year comparison by month, and a carrier ranking chart, which comes directly from the enrollments that were made through our system. Under MyMFG sales, we see leads distributions. This is a leads report line graph where you can see clients created each month, assigned leads, and sold leads. Further down, we have a commissions link. Here we can filter by a specific carrier and see a line graph representing the commissions paid each month. So this carrier paid, we hover over this dot, $50.67 in the month of May. We have a year-to-date commissions chart here on the right and a policies paid line graph that reflects that information. If we click on the profile icon, we are taken to the profile page on MyMFG. You can also find this page on the other side under Other, up here on the top right, and then My Profile. And here you can upload a picture. You can see your basic demographic information. You can also see your appointment request. Here you can see the carrier, the status, the state, and the last activity date, as well as your writing number. You can filter this by carrier, by agent, or by status. If for any reason you need to export this information, you can simply do that by clicking this blue Export Appointments button on the top right. And so going back to our profile page, we also have a third link down here to view your permissions. These are permissions that have been activated for you. ACA permissions, a specific state, Medicare, or a type of product like PDP permissions, or just specific carriers that you need permissions for. You can see here, you can see the status of these permissions as well as the state and product type. Now, if you were concerned about a certain permission being activated, you could always reference that here, but you can always call the producer support team at Messer Financial, and we would ensure that your permissions are updated. So now that we have seen the landing page, which is our dashboard, and it's 3 sections, I want to show you guys the agency view available to agents with agencies. That is a special permission that we can activate on MyMFG. Here you can see agents. You can export agents list, your MyMFG users. In case one of your agents gets locked out or needs to reset their password, you can actually do that here as well. You can see your agency's appointments, and then you can also see your you have this ability here to administer your leads. So if you wanted to assign a lead to one of your agents, you would just click on the lead and then, we'll click here and then assign. And then we would be able to choose the agent that we want to assign the lead to. And since we're talking about leads, I'm going to go ahead and show you as well our leads tab. This is our leads manager tab where you can see all of your leads that are available at the moment. You can upload your own leads. You can use any credits here. You can view your credits here, and you can also buy mailers on this button. You can filter out your leads, of course. I'm going to go back to the dashboard. So that was the introduction to the MyMFG page, the first part that we're going to go over. Moving forward, we're going to step into what I would think is the initial concern for agents, which would be actually creating a client profile. Once you have onboarded with Messer and have started requesting contracts via SureLC, you will have to store and manage your clients on the platform. So there are a couple different ways to create client profiles, and I'm going to show you each of them. The first one will be by simply creating a client profile from scratch. So we'll head over to Clients, and then we'll click on View Client List. And here, using this button, Add a New Client, you would be able to add a new client. So here you see this form where you would fill all their information, contact information, residential information, mailing, household, employer, medical. And then once you're done, you just click on Save Client, and that client profile would be created for you, and you would then have access to it in the pool of clients here. You can easily search for the client here, as well as this new feature up at the top, so that you don't actually have to go all the way through the tabs. You can just simply type in their names here and search for the client. We can filter our clients by birthday, age, and a few other options here. We can export our clients if we need to save it into our computer for our records. And we can also import and upload our client list. This here is the second way we can create a client profile. So let's say you have used maybe a different platform before, like Health Sherpa. We do support the export file that you get from Health Sherpa. We are able to directly upload it into our client list here into MyMFG. So it really has no issues. It's very seamless, very easy to do. Just as long as you don't edit the file when you export it from Health Sherpa, you should be able to get that process through here. Now, you also have the ability to use our template here. You can download this template in case you have a separate book of business that you may need to adjust to assure that it transfers smoothly into MyMFG, but that is also available for you here. So these are the two first ways to create a client profile. We can start by scratch with this button, and then we can also upload a client list. All right, and so we also have a third way to do creating a client profile, which would be through the enrollment process. So we'll head over to quote and enroll, and we can search for a client, but in this case, we will add a new client. And then we'll select the product, and then you would be taken to this page again. So here you would insert the information, and then you would be able to continue with the enrollment. We can also do this via a quick quote. Say we're running an ACA quick quote. We would do the same thing. And finally, the last way that I want to go over for creating a client profile is a bit more intricate. So I am going to go step by step. Because I am using a staging account, you will have to visualize a couple of the steps for the sake of saving time. I'm going to go over to quick quote. And as you see here, there's a send MA link to my client, and under ACA, we see another send link to my client. Now, if you wanted to send a link to a client, and by the way, this link is extremely useful. You can post it on your website. You can send it via email or text message to a prospective client. So it's pretty nice having that feature there. Let's say we want to send them an ACA link. We would copy the link and send it to them. But in this case, I want to show you guys this. So I'm going to open up a new tab. And this is what they would see. So they would put in their information. I'm going to quickly just fill some of this out to show you guys. We'll skip the hard part, but this part should be pretty easy. Perfect. All right, and then you would be, they would be able to see the subsidy. Now remember, this is something they're doing on their own. They would view the plans. So they would be able to do this on their own time, as long as you send them that link. And then here, they would look through their plans, and they could, if they wanted some help, could look up at the top and they'd see your name and your phone number. And then once they choose a plan, they would click apply, and they would have these two options. They can email or call you by clicking here. Or if they are feeling a bit independent, they can click apply. Now, obviously, they are not a licensed agent, so they will not be able to apply on their own. So this part I am going to skip but they would be able to put all their information in for eligibility purposes. And once it's done and completed, this is the important part. This is what I wanted you to see. You would receive a notification over here in the task tab, just like that red notification that popped up. And that new task will pop up here with their name. So you would get that notification and then their name would populate there. And if you clicked on that name, you would see the entire intake form. So all of that information that they put in would be available for you there. You would be able to print that out. You could save it onto your computer as a PDF. And that way you could use that information to do an enrollment. So in addition to that, once that task shows there, you actually have that client profile stored in your MyMFG. So essentially they created their own profile by you sending that link and them completing that information. So that is the last way to create a client profile on MyMFG. So just be aware of that once you send that link and they do that, your client profile for would actually already be created and be able to be found under clients right here. Okay, so let's just do a quick recap. We can start from scratch. We can upload a client list. We can create a client profile by starting an enrollment or a quick quote. And finally, we can create a client profile by sending out one of those two links. So now that we know how to store our clients in MyMFG, I'm quickly just going to touch on our task tab, since we've already been here today. And I just want to just show you that you can add a task here, set your due date, and you have your different categories here of your task. The purpose of this is really just to keep you on track and to keep you organized. So just think of it as an agenda, a checklist. You can hit complete and that task will disappear. All right, so it's just a good way to manage your to-do list. Now that we know how to store our clients in MyMFG, I'm going to quickly just show you what the client profile actually looks like. So we'll click on a client. All right, and so you can see each section here, the primary information, contact information, mailing address, physicians, pharmacies, prescriptions, activity history, enrollment history, scope of appointment history. So I do want to note that we do have an option here to add an external enrollment. So, if you had a client that you had previously enrolled using a different platform, or you had it stored somewhere else, it wouldn't initially pop up here, but you could always add an external enrollment and then upload any files that are relevant to that enrollment here. And that way you really have a complete record of their enrollment history. So that was a very nice, generous addition from our IT department, our development team. We can also complete a scope of appointment here, but also we have the client actions here where you can select a plan, complete a scope, report ACA life change, link to Blue Button, or just delete the client. If you click on any of these, you'll just be taken to that section of the client profile so that you don't have to manually scroll down. We can add a spouse, we can add a dependent, and we can, all right. So that was the client profile. And the one more thing that we're going to look at that has to do with clients is our reports tab. So I'm going to click on other, and we're going to scroll down, come down to the reports. This first section will be available to agents with the agency permission. So you can see your year-to-date production report, overall production report, leads dispositions, agency external enrollments, and then client reports is available for all of our agents. you have a couple different filters here, options, and you could download it. You have your enrollment reports for Medicare, as well as for ACA, and also external enrollments. So these are easy to just view or download. All right. And so now we are going to move forward with the presentation and go ahead and talk about enrollments, actually how to get into the main goal here, which is to enroll our clients via our platform. So we're going to start off with a Medicare enrollment. I'm going to go over to quote and enroll. All right. And then I will choose a client. And there's one thing I want to show you here. Very useful tool that we've gotten a lot of good feedback about, which is this BEQ beneficiary eligibility query. And so here you get a ton of information. You get the address, the parts A, B, and D dates, Medicaid, yes or no status, and LIS copay levels, Part D subsidy percentages. This is just really, really useful for you guys. So just please take advantage of this tool. I'm going to use my test client for the enrollment. All right. And a lot of you are familiar with this, but I will go step by step. I'm not going to add anything, but just so you can see kind of what it looks like on My MFG. You choose your providers. You can add a provider here. Locations. Prescriptions. Now, if you've already included prescriptions in the initial client profile creation, then they will also pop up here. You would just have to make sure that they are selected. Pharmacies. I'm going to continue without choosing a pharmacy. All right, and then we can see all of our different quotes, all of our plans available for the client here. Very user-friendly. You can see the plan type, the monthly premium, the estimated annual RX cost, the copay for specialists, the deductibles, the maximum out of pocket, the providers covered, and the star rating. Over here on our left, we have an abundance of filters that we can use to narrow down our search. We can do filter by carrier, plan type, the premium range, and then this is a new, fairly new feature here as well. This filter for Part B give back. So if any of these plans assist with that Part B, it would filter to narrow it down to those plans. I'm going to go ahead and select a couple plans so that we can compare the plans. I'll choose this WellCare plan, and let's do this United Healthcare plan. Quick note, if you do see a gray button where it should be green, it means that something is not, there's a permission that's not cut on, excuse me. So just know that if you ever see that, you can always give producer support a phone call, and we would be able to take care of that for you quickly. So we're going to go ahead and compare plans. Here you have a very detailed side-by-side comparison of the plans. You can always print this out. You can save it as a PDF. You can email it to your client, but it's really just convenient to have that ability to just save this. You can see the side-by-side comparison of the premium, the co-insurance. You can look at in-network benefits, pharmacies, donut hole, co-insurance, dental, vision, and hearing benefits, And then here you can see that Part B give back we were talking about. So $42 is what WellCare would contribute or assist with versus United Healthcare up to $75. Some really great information here to really make sure that you're choosing the best plan possible for your prospective client. As we get down to the prescription drugs, of course, you can see the tier of the drug. We've added quantity limit. We've also added step therapy. So if a drug qualifies for step therapy, it will show here. And if a drug requires prior authorization, you can see that here. So those are all new add-ons to the quoting side of Medicare. And then of course, once you've selected a plan, you are here at the scope of appointment where you could, if you are in person, select that option, but you can also email that scope of appointment and you can send it via a text message. Right now, I'm going to click this option. And then finally, you would complete these steps for the enrollment, and then that would be stored into your MyMFG under that client's enrollment history. So right now we're going to stop talking about enrollments for a second, just because we were talking about the scope of appointment and compliance. So I know that we all have to record our phone calls for Medicare. So before jumping into ACA, I want to show you guys briefly just show you guys the software that we use to record our calls. We'll go over to clients and connect. And Go to Connect is the software that we use to record our calls, to store our text messages. It's a pretty convenient tool to have. Now, I will say if you are using the desktop version, you will need to redirect to Go to here, and that will open up the Go to Connect website. You'll hit reload. And so you do have to have both of them open to use on your desktop. However, we do have the app available as well. So we can help you with getting that set up on your phone. We're really pushing our agents to use GoToConnect for ACA as well. I think that it's just a really good tool to have just a record of your communication with your clients in case you need it as a reference. Let's say you forgot part of the conversation or something that they said. You can always go back and look at the call. You would click this caret here, and that call would be recorded. You can listen to it. You can change the playback speed. You can download it. And then also just for compliance purposes, if anything were to happen, it's just easily accessible. So it doesn't hurt to have that for ACA as well. And if you're part of one of our programs, if you're an All-In or Medicare Start, you have that available to you. So it's might as well take advantage of it. You can also create a meeting, just like Zoom or Teams. You can create a meeting and you can record that meeting. You can add, you can share your screen. You can have multiple people in that meeting. So just really useful stuff. I'm going to go ahead and close out of this. All right, so now we're going to jump over to ACA enrollments. So we're going to go to quote and enroll. We'll choose a client. All right, and so as of right now, we can only do a quick quote in this present moment for ACA. If we do an enrollment, it will bounce us over to healthcare.gov. But I'll talk a bit more about that in just a moment. So we already saw a quick quote earlier when we did the send the quick quote link. But if we begin an enrollment, you will see you have the option to email that consent form, or you can proceed if the consent form is already on file. And then that is when you would be redirected to the marketplace. And so I want to go ahead also and show you that that consent form is also available for you and easily accessible by clicking Other, Support and Training. Here, that consent form is available in Spanish and in English. You can download this form. It is a fillable PDF. You can email it. You can print it out. Again, that was in Others, the Other menu, and then down to Support and Training. And while we're here, we'll go ahead and look that in Support and Training, we have a lot of useful tools. We have a setting up go-to mobile app page here for instructions on how to get that set up on your phone. Now, of course, you can always give us a call at Producer Support, and we will walk you through it through each step to get that on your phone, get that app working and authenticated with your MyMFG. We have our enrollment guide that we update every year, so you can see which plans you can quote and enroll on our platform, scope of a point requirement, and if that carrier is offering HRAs, and the call script for Medicare calls, and we have some helpful webinars here as well. All right, so going back to ACA, I just want to let everyone know that EDE is coming soon. We are just waiting on CMS to give us the green light. We're anticipating and we're very hopeful that it will be before open enrollment. You won't have to be redirected to healthcare.gov. Everything will be seamlessly done via our MyMFG platform. So that is something that we are really excited about, to be able to have everything all in MyMFG without having to, jump from one thing to the other, just making it really convenient for you guys. We're working hard to make sure that this is going to be available. We're doing everything we can to make sure it's available for the open enrollment season. But something new with ACA that I want to show you is this commissions reconciliation. Here you'll be able to keep track of all of your premiums, all of your payments. Here you can filter the policies. You can download this report. You can email commissions if you see any, if you have any discrepancy or any concern or anything that you want to talk to commissions about. There's a very convenient button here at the top right. So here, the total applications are in blue. The current policies are in green. Any missing payments, maybe the initial payment or if a balance is past due, will be in yellow here. And then in red, you see the policies that are missing 2 or more payments or that never actually effectuated, and policies that have been terminated. So you definitely want to keep an eye out for the yellow and the red. You can scroll down and you can see the information of the client, the plan, the carrier, the effective date. If you click on more details, you can see a breakdown of the payments per month. So that way, if you guys see that, maybe in May, a policy wasn't paid, but then in June it was, you would be able to look here and see that. You don't have to rely on the carrier. You don't have to rely on anyone. We're taking care of it for you guys. Our commissions department is working hard to keep this up to date for you guys, for your convenience, and to, so that you guys are in control of, your money. So this is a new addition that's available only for ACA at the moment. It is included in our ACA Star program. So something definitely to take advantage of. Over on the other tab, we also, I will just mention we have the commissions option here. This takes you directly to the eAgent Center. This is where you'll actually see your statements. So you'll have details of your commissions here. You'll have your tax forms, 1099, and then again, you can always email commissions, or you can just click on that convenient button to email commissions if you have commissions reconciliation. But the email is commissions@messerfinancial.com. All right, so we've pretty much gone over all these tabs here. I'm going to go ahead and go over the last couple options that we have here in the menu bar. The first one is going to be quick links. So this is where you'll find your Medicare certification information for your AHIP, the ACA certifications and information for your FFMID, for your FFM certification. You'll see state exchange information, carrier registration codes, and the carrier index. You have access to the eAgent Center here as well. Upcoming events, so like this event, any events in person or online will from MyMFG, from Messer or carriers will be available here for you. You can just click on the event and then register. You can invite a friend. If you ever have a client that you cannot write a policy for, maybe because you're not licensed in that state, you can always refer a client, fill out that form, and we'll take care of them. You have the CSG quoting tools available here, and then online contracting, which takes you straight to SureLC. These quick links are the same links that are available in the Agent Center on the messerfinancial.com website. In the Agent Center, once you log in, you should be able to see this, but it's pretty convenient to have them right there in quick links. Alrighty, and then as we go down, we have Marketing Studio. Here you can find the ACA flyers, Medicare flyers, life flyers. You can edit them, you can download. And we have our compliance corner here. So we have our consent form also available here. Frequently asked questions in reference to call recording. We have a reference guide available. And then if you guys ever have any marketing inquiries as far as compliance goes, you can always submit a request here, submit this form, and we'd make sure that whatever you are presenting is in compliance. We have our Messer marketing store here. This is where you can purchase what we'd like to call swag. Market yourself. I really like the mugs right here. I think that's pretty cool. And then don't sleep on our pens because our pens are actually really, really nice. So, and you have your sales tools and resources. All right, and then going back to the other tab here, we do have a direct link to go to healthcare.gov. So if you click here, you'll be directed straight there. And we've recently added this translation. We've always had a translating button, but we've never had it where it translated the entire platform. The only thing that is not translated yet is Medicare enrollments. But you can see everything is translated in Spanish in case you have any Spanish agents that want to have that option, or Spanish speaking agents, excuse me. I'm going to go ahead and change this back. And we also have this chat box here. Our producer support squad is always available to you guys virtually as well now. So if you ever have any issues or have any questions, you can just type in a message here and we would be available immediately to respond to you. So that pretty much covers everything in MyMFG, guys. Oh, there is this button here. If you ever just need to go back to MyMFG dashboard, you can click here. But that wraps up the presentation portion of the webinar. We will now go ahead and open the floor to any questions that you guys may have. I know that it was a lot of information, but this is being recorded and this will be posted on our website. Chris, I'm going to go ahead and give the floor to you so you can address some of the questions that the agents may be having.
Thank you, Nelson. You did a great job. It was very informative. And now we're going to ask some of the questions that our agents have asked us. Are you ready?
Yeah, absolutely. I am ready. And then, guys, if there's a specific question that I do not know, I do have my IT team ready as well to answer any questions you guys may have.
So the first question is, do we add the same information for leads and move to clients when sold? I guess my question would be, is it a lead that was purchased through MyMFG? Because those are automatically added to your client base when it's sold. But if it's an outside lead, then yes, you would have to add those manually after being sold.
Correct. If it was outside of the leads that we provided.
All right, can also an Excel list be exported into the system? Could you go over that option for us, Nelson?
Yes, absolutely. So when we go to clients, view client list, we can upload the client list here. Yeah, that Excel sheet will need to be maybe tweaked to be able to be uploaded. That's why we have that option here for the template. As long as it's like the template, then you would be able to upload it. But that template is an Excel file.
All right, the next question is, what is the purpose of the health status question in an MAPD enrollment? I'll answer this one. When we first developed MyMFG, we had to run this system by every carrier that you can enroll, and that was one of the questions that the carriers kind of added to the system. So that's why it's in the system. All right, Nelson, how many plans can we compare at one time?
I know for sure 3. Let's look here. Okay, it says print page can only fit up to 4, but it looks like we can compare more than 4. I can ask right quick so that we don't spend clicking 5, 6, and then 7. I'll just go ahead and ask the IT team if there's a limit. But we can go ahead and continue on with that next question.
If you text the SOA, can you send it 48 hours ahead of time?
This is something we were talking about in our department yesterday. Chris, isn't there a rule now? It's a rule that it has to be within that 48 hours.
Yes, it has to be within the 48 hours, but yes, you can text it at any time prior to the 48 hours.
Okay.
Connecting to Connector is tedious in the past and fails often. We worked on our connectivity with Connector this year, so I think you should see an improvement in the functionality of that system. Will we now be able to complete the HRA for United Healthcare?
Well, let's look over.
I'm going to have to check the enrollment guide. I'm not sure if that's been added for this AEP or not, but could you check the enrollment guide real quick?
Yeah, absolutely. So we went to other and then support and training, and here's the enrollment guide. This was the 22-23 year.
Yeah, we have not updated for 2024 yet. Let me ask our IT development staff real quick if that's in the works for the 2024 enrollment season. While I'm waiting for an answer, we'll move on to the next question. Are you going to make it where you can keep a family together where you don't have to promote spouse to a new account?
Initially, I do recall having a conversation with Trip about this because we did have an issue every once in a while. I think he is working on trying to see if there's a more seamless way to make sure that we don't have any error messages when it comes to doing those types of enrollments. So that is some feedback that we have given him. And, as you guys know, any feedback that you guys give us, we communicate it to our development team, and they are adamantly working to make any improvements to make the experience more seamless.
And unfortunately, no, United Healthcare, the HRA will not be available in My MFG. When will the commission reconciliation be available? It is currently available to our all-in agents and our ACA STAR agents. So if you have any questions about those programs, you can call in and speak to one of our marketers about it. But right now, you have to be either all-in agent, which means you have all of your contracts, Medicare Advantage, ACA, supplemental, annuities, life with Messer, or ACA STAR, which is the program where you have all of your ACA carriers with Messer. But it is available to those agents as of today. All right, the next question is, I tried to enroll a client in a MedSup, but the carriers are limited. That is because you can only enroll Medicare Advantage and ACA in My MFG. If you click on MedSup, it's going to take you to our CSG quote tool, and you can enroll some of the carriers in our CSG quote tool, but you need to let us know because we've got to turn you on for that that enrollment process on CSG. But you can enroll them in My MFG. If you click on the MedSup part in My MFG, it's going to redirect you to the CSG quote tool. With ACA, will Messer provide upload area for required documents?
I will have to check with Trip on that. That would be very useful. I would think that that's something that they would implement into the.
I think you can upload documents to a client's profile. Can you not? Could you check real quick?
Yeah, we can already go ahead and do that, but I was wondering if they meant, let's see. Yeah, so once the enrollment's been completed, you can go here and go down to enrollment history, and then you can upload a file here. So any documents that you need that have to do with enrollments, you can upload it here.
And the original question we had about the leads, about adding leads to your as being sold, that was for self-generated leads. And then yes, if you have a self-generated lead, you're going to need to add the client to your MyMFG profile, and then when you sell the plan, then you mark it as sold. But if it's not something that we send you or you've ordered it, it won't automatically be available in your client profile. So yes, you have to manually create any self-generated leads you have throughout the AEP. Nelson, can the client list be filtered to run alphabetically?
And there we go. So you would just click on client name, and it would sort it by the last name, as you can see here. You can also do that for phone numbers. So
Okay.
yes, you would be able to do that alphabetically, clicking client name.
Do we always do scope of appointment, or are they done by the lead source occasionally? No, the scope of appointment needs to be done by the writing agent. Nobody else can do the scope of appointment but the agent who's actually enrolling the client. So the lead source would never do a scope of appointment. It's always done by the agent. All right, my MA quote link takes me to a Medicare and Me permission to contact form, not the quote tool. Is that normal?
Let's see. They said the MA quick quote, right?
Yes.
Okay, this is where it should take you.
Yeah, so it's not the quick quote, it's the quote that you want to send to your clients. It does take them to the consent to contact form first.
Okay, so we can definitely look into your account and make sure that you're getting the right link when you send that out, you can just shoot us an email or give us a call, and we'll make sure that that's adjusted if it's sending you to the wrong place.
I'm not sure I understand this question. Can we attach the link to the ad as a landing page?
So I know we can attach that link to like a website, and they'd be able to click, and it take them straight there. To make it a landing page, I don't think that you would be able to do that. If you do have a website through Messer Financial, we can look and see, but I'm certain that link is just to it would just be an add-on to your website or to the app.
Yes, if you're a all-in agent, Medicare Star, ACA Star, one of the benefits of the program is to have a custom-made website. And I know on that website, you will provide the link for your quick quote for both the Medicare Advantage and ACA, and they will embed that in your website. So I know that's possible. Nelson, can you show where the script is to be used for enrollment recordings? Is there a script still out there?
Yes, you'd go to other, you'd go to support and training, and then you'd find the call script right here. You have the introduction,
Okay.
key questions, setting the appointment up, and that's available in support and training.
This is another question about importing data. It's by Health Sherpa and Medicare Center. Could you show again how you get to import data into MyMFG from Health Sherpa and any other source they may have?
So when you export that file from Health Sherpa, you just want to make sure that you don't edit it. You're just going to upload it directly. We're going to go to clients, and then here on the right you'll see an upload client list, external client report, and you would choose that file and then upload client list, and it'll populate here for you.
Could you show the template that shows the fields that are necessary in the order they're necessary?
Yes. Let's see here. It's also listed here, but I'm going to open up that template. And so you have the first name, middle name, last name, gender, email, Medicare, Medicaid.
And any field name that begins with the asterisk is a required field. So you have to have that field filled in before you can upload any data.
So really just looking at the city, zip code, the home phone number, date of birth, gender, last name, and first name.
Can we do Can we do HRA through this system? Could you go back and show how to get to that? Pull that information back up for me.
The enrollment guide.
Yeah, and if you scroll over a little bit to the right, it'll show you the HRA that you can do in the system for 2023. We have not updated this for 2024 yet, but we will shortly. But I have confirmed that United Healthcare is going to be a no still. Is Medicare available for send link?
Is Medicare available to send link?
Yes, to clients.
Yes, we can go to quick quote, and it'll be right here. Send MA link to my client.
And agents letting us know that you can compare no more than 3 MAPD plans at a time, but you can compare more on the ACA plans. But I think on the ACA plans, they only will print out 4. So even though you can compare 5 or 6, you can only print out 4 if you want to print the plans out.
Yeah, it looks like you can. They said that, the IT development team said that they're removing any limit that there is to being able to compare the plans. It does get very tight eventually, but as far as printing goes, yeah, I think it said 3 or 4 is what's going to fit on the page.
Okay, this is about how review how to record calls. And would you also talk about the criteria that we use to allow an agent to use our Go to Connect feature?
We're going to go ahead and go over to clients and go to connect. Redirect to go to, make sure that both of them are open. So Go to Connect is a feature that we have available for our agents in the all-in program for free. It's also inclusive of the Medicare Star program. You can always purchase Go to Connect for $20 a month. We will turn on that feature for you in My MFG so that you have access to Go to Connect. You would just dial the phone number here. You could also do it here. And as soon as that call is made, it will record the conversation. It works for inbound and outbound calls. So if you wanted to, include this phone number that's assigned for you, this is your unique Go to Connect phone number, you could post that on a website. You can include it in your business card, on your business card. And that way, anyone who's inquiring about a policy would be able to give you a call, and you would automatically have that call recorded.
All right, this next question is about texting the SOA. So what does the customer see, and how do they return it signed and MyMFG receives it?
That's a good question. So I'm going to go over to clients, and we're going to scope. So we have a couple options here, in person, right? Virtual email. So right now what happens is the client gets an email that just, says that they agree. It's a very descriptive email of what they are agreeing to. I think I can pull it up for you. Or a virtual SMS. Let's see here. Oh, actually, I apologize. It did not pull up. It's just an email stating that you can provide information to them about enrollments, and then they would just hit I agree at the very end. They would just type that in the email and send it back. However, the IT development team is working on having a system where it would just send out via text message or email, and you would simply just need to select yes or no, just to make that a little easier. But as of right now, it is a text message that you receive, and it is an email stating, giving permission to enroll and to discuss the plan. And the client would just type in I agree, and then it gets sent back. And then that populates into your MyMFG database as a scope of appointment history.
I will try to get that text and email verbiage from our IT development, and I'll send it out to everybody that attended the webinar so you guys can have it. The next question is, would there be an ACA consent document like scope set up, or will it be the way it is now?
There is that ACA consent form over in other. We can go down to quick links, and that consent form, that support and training, and that consent form is here. Once you start a quick quote for ACA, it also pops up before continuing. I know I had that email pulled up earlier when the Medicare. I'm going to try it one more time. Let's see here. All right, here it is. Oh, it didn't pop up.
The IT development team said that the client will see a text that says your hello sign scope of appointment link, and there will be a link to the unique URL for the client to click on to complete the scope of appointment online. And I think at that point you should receive a task, response in your task that the scope of appointment was completed.
Yes, it'll pop up here. Correct.
The next question is there a way to set time out? I will enter info, then it will make me sign out in again like it is timed out, and the info isn't saved. CMS has required us to have a 15-minute system timeout. So we can't do less than 15 minutes and more than 50 minutes. So if you don't do anything in a 15-minute time frame, the system does shut you down. You have to restart it over again. But that is a CMS requirement. Documents for ACA would be income documents or Social Security required needed, as Health Sherpa lets agents know when they're needed. I think when we approve for the EDE platform, that information will be included when we switch over from our DE platform to an EDE platform. So stay tuned for that update. All right, this is going to be the last question. Will you be adding a more robust CRM like email, text workflows, etc.? And the answer to that question is yes. We have a couple of webinars upcoming for something called My MFG Plus that will be our CRM. So we have some webinars coming up either this week or next week, and I encourage you to sign up for it so you can check out the functionality of the new My MFG Plus. All right, thank you for joining us today. It's been a pleasure on the webinar. Nelson did a great job. If you have any questions, you can contact producer support. If you have any My MFG questions, you can contact me personally, Christopher Middleton. I'm the Director of Agent Services, so I handle contracting and producer support. And of course, you can reach out to Nelson if you have any individual questions. So thanks again. Have a great rest of your day, and happy sales.